Hi, my name is David. I'm a pharmacist, and I'd like to talk to you today about vaccinating different communities. So let's talk about vaccinating pregnant women. So I don't need to convince anyone that immunizing pregnant women is incredibly important. It has the benefit of not only protecting the pregnant person themselves, but also passing on passive immunity to their child as well. Another reason why immunizing this population is so important is the concept of maternity healthcare deserts. This was a term coined by the March of Dimes recently in their study that found that over 35% of counties in the United States are considered maternity health deserts, defined as being devoid completely of access to OBGYN care, and this is worsening in the United States, especially in rural areas. They found in this report that over 2.5 million reproductive age women currently live in a county without access to any OBGYN clinician, and additionally 150,000 babies are born annually in these counties. So as a result of this, it should be no surprise that pharmacists' provision of vaccines to this population is incredibly important and is a necessity for public health. Now, one of the concerns that we sometimes see is hesitation around providing vaccines to pregnant women because there are somehow perhaps special considerations around them. And I want to dispel this myth. The vaccination process for vaccinating a pregnant person versus a non-pregnant person is essentially the same. Administration technique is the same and safety precautions are the same. And so this should not be a barrier to vaccinating this population. Now, the big vaccines to remember for pregnant women are Tdap, which should be given in the 3rd trimester of every pregnancy, RSV, which should be given in weeks 32 to 36 of pregnancy between September and January, and currently that is once per lifetime, as opposed to Tdap, which is given every pregnancy. Now, additional important vaccines to consider are influenza, which should be given once per year. There's no trimester requirement necessarily for that, or timing requirement, as well as COVID vaccine, which should be given per the current CDC recommendations, and also no timing restriction as it relates to gestational age. All right, so let's talk about gestational age, because this is a consideration regarding certain vaccines like Tdap and RSV that can only be given at a certain point in the pregnancy. Gestational age is fairly easily calculated from the pregnant woman's last menstrual period date. Additionally, if patients don't know their last menstrual period date, they may also know their gestational age from ultrasounds and other studies that can be done by their OBGYN or family health provider. And as well, for patients who have conceived via in vitro fertilization, there are other specific calculations for gestational age. Suffice it to say, you don't need to commit these calculations to memory, and there are a number of helpful online calculators to assist with this. And so the major important thing to remember here is that for certain vaccines, there are certain gestational age requirements, and to remember to calculate gestational age for those vaccines to determine patient eligibility. Importantly, influenza and COVID vaccine, which are incredibly important in pregnancy, can be given irrespective of trimester, although some patients may prefer to wait later in their pregnancy, depending on how their pregnancy is coinciding with influenza season or how COVID rates are going. All right, so let's talk about how to advertise or market the fact that you provide vaccines to pregnant women. I can't underscore the importance enough that it is important to advertise that you do this, because some patients may think of pregnancy vaccines a little bit separate from vaccines outside of pregnancy, and may think that maybe they can only get these vaccines from, say, an OBGYN or a family health provider, and that is certainly not the case. So it's important to advertise and make patients aware that you provide this type of care. It's also helpful to be on the lookout for people who are buying pregnancy-related items like, say, prenatal vitamins or pregnancy tests, to also make them aware that you provide these services. It's also helpful to partner with community centers, churches, or other local centers and advertise the fact that you provide these services, as well as health departments who can potentially include you in vaccination initiatives in a local region. Now, I want to talk a little bit about a couple of safety concerns as it relates to vaccinating pregnant women. Importantly, live vaccines like FluMist or MMR should be avoided during pregnancy. And another major consideration as it relates to RSV vaccination is that Abrysvo is the only formulation that can be given to pregnant women. Other vaccine formulations like Arexvy or Mrezvia are not considered adequate immunization for RSV for pregnant women since they are not approved for this population. So just remember the B in Abrysvo for belly. Another final important point to think about when it relates to pregnancy vaccinations are the importance of vaccinating the people around the pregnant woman, making sure that the spouse or other family members or friends that may be around this person are up to date on influenza vaccine, COVID vaccine, Tdap, and other types of vaccinations. So those are just a couple important points as it relates to vaccination of pregnant women.